I think something we want to talk about before we get into the very kind of nitty-gritty, which we will do later, of these marketplaces, because we want to walk away from here tonight with an understanding of what these marketplaces are all about. I want to talk more about something we just touched on there with Tim, that is the role of the marketplace in the Affordable Care Act. And we have some great guests here to help us do that. I'll do some introductions first, starting with Kevin Regent over at the Regent Law Firm. How great that you grew up and were able to work at a place that has the same name as you.
Amazing coincidence.
That's a fascinating coincidence. Sydney Watson, that's my last joke for the night, just so we're clear. Sydney Watson from the St. Louis University Law School, and Mark Smith, St. Louis Area Agency on Aging. You're also you're one of the qualified navigators that we will be hearing about more tonight. So I'll ask you just that. Does this marketplace that we're talking about, does that have to work for the overall Affordable Health Care Act to work?
Yes. The Affordable Care Act is about reforming and changing how we purchase insurance and how insurance is sold in this country. And the marketplace is central to that, to create a better functioning marketplace.
And I think it's important to add the marketplace needs to attract, healthy clientele. I mean, if you have adverse selection of only those with conditions who couldn't be insured getting in, it'll be difficult for the marketplace to succeed. But if you can attract those younger, healthier new participants, I think that will bode well for the law's future.
Yeah. There are also new market rules that make it easier to shop and more attractive to shop for individual insurance in the marketplace.
What do you mean, new market rules? I mean, what does that mean?
No pre-existing condition exclusions. You can't be turned away because you're sick. You can't be charged more because you have a health condition. New rules about what health insurance have to cover, 10 essential health benefits, new limits on out-of-pocket expenses. It makes insurance better and a better value for your dollar, and we hope that's going to bring in young, healthy people as well as older, sicker people.
Go ahead.
I was going to say, and because of those, those new rules, it's even more essential to bring in the young people because, those new costs of pre-existing condition patients. It's great that they can get coverage, but those costs need to be covered. They need to be basically socialized. It's all insurance is socialization of costs. And now that the spread of what you can charge the healthiest to the not healthiest, in Missouri it used to be about 9 to 1, 9.5 to 1 is now 3 to 1. So you need a lot of people at the healthy range to cover those newly insured people to make the system really succeed and keep the insurers involved. Because remember, it's built on the private system. Built in the private insurance system, a profit-driven system. So you need to make sure that those insurance companies can still make profits to stay in, to keep offering the programs through the exchange.
Although one of the things that happens with the Affordable Care Act is we've limited the amount of profits that insurance companies can make. So there are now new rules about how much of our premium dollars has to be returned to us in health care. And those limits are going to apply to both products sold in the exchange and health insurance sold out of the exchange. And that's important for all of us.
Okay, so something else we touched on with Tim, what does more people in the system mean to our healthcare system? Is that going to have an impact?
It means we'll be giving people preventive care and wellness care, helping them learn how to take care of their diabetes, how to control their high blood pressure, and hopefully over the long run we'll be a healthier population, a more productive workforce. Remember, part of what we've already instituted with the Affordable Care Act is a requirement that health insurers cover an annual preventive care checkup at no cost. So it's an important way we're changing the focus of medical care.
Mark, is this information getting out to the people you work with when it comes to the marketplace?
Well, we're working really hard at getting that information out to people and making sure people have the facts in front of them to make wise and informed decisions. We're finding that a lot of people are very confused. There's just a lot of misinformation out there, and we want to do the best we can to get that information in front of folks to make those important decisions for themselves. I mean, health insurance is such an important piece of a person's health in their life, and we want them to have the facts in front of themselves.
What's the number one reason? Why are they? I don't want to ask you what they're confused about because I don't want to put out bad information. But why? I guess I'll start with why, and then maybe we can figure out how to prevent that.
Why are people confused?
Yeah. What's the problem?
Well, I mean, that's a good question. I mean, it's health insurance. Health insurance in and of itself can be kind of a confusing thing to understand, and people are are kind of stuck in wanting to know what those facts are, but there's not a lot of ways out there for people to know what they are. I mean, we're starting to get the word out, starting to come out, but this has been a long process. The Affordable Care Act has been around for a couple of years, and there's different pieces that have been coming into effect. And so there's just a lot for people to learn.
It seemed like October 2013 would never get here, and here we are, and they've opened up this month, these marketplaces. So again, without trying to bring out the bad information, what is the good information that you wish people knew that sometimes you hear questions about? What would be that piece of information?
Well, the first thing I would say is that people really should go ahead and talk to somebody, a navigator, call the 1-800 number, go to healthcare.gov, and put in their information and see if they might be eligible for some subsidies. Health insurance is a monthly cost that people need to budget for, and if they might be eligible for a subsidy, well, that could really help them. And they may be able to afford insurance now, or may be able to get something cheaper than what they have, or something of higher quality.
Continuing to crawl before we walk, that's the third time I think we've mentioned navigator. I'll leave the floor to you for a second, since you are part of the navigation.
Right.
What is a navigator?
Okay. Well,
are you voice activated?
Yeah. We're doing three main things. We're out doing presentations, just educating the public in group settings, and we're also doing that on a one-on-one basis, answering people's questions. They can call in to us. They can have a one-on-one appointment in person, and then we're actually going to walk people through the application and help them navigate the website or the 1-800 number, whatever that may be for them,
right,
and help them get all the right information into the system, get the response from the marketplace to what their options are.
Tim mentioned the effects of Medicaid expansion, or the lack thereof, in Missouri. How does that play a role into this conversation we're having here?
Well, it's a critical role. We have about 500,000 Missourians who are going to be eligible for new coverage, and most of those people, about 80%, eligible for subsidized coverage through the marketplace. We have another 300,000 Missourians who earn under the poverty level, for whom there are no premium tax credits. The way the law was designed, there was supposed to be a Medicaid expansion for the poorest Americans, and then new premium tax credits for those earning a little bit more than that. The Supreme Court decided that that would be the state's decision whether to expand Medicaid, and the Missouri General Assembly has not yet decided to do that. So we have 300,000 Missourians left out. They can shop in the marketplace. The trouble is they have to pay the full cost of health insurance, which, when you're making minimum wage, can be just too much.
We're about 15 seconds in this segment. Did I cut you off on that same question there, with the Medicaid aspect of this conversation?
No, I would say I would build on what Professor Watson said and say that I know there are efforts in the Missouri General Assembly, I know she's aware of them, to see if there can be some solution to the issue of people ineligible for coverage and ineligible for to enter the marketplace. And we will see in the next General Assembly session if any fruit can be born from that.
Very good.